So Shockwave Therapy is a fairly new physical therapy that we use in our office. It basically is a machine that produces really intense sound or pressure waves. Shockwaves is the fun term, that basically trick the cells of the body into thinking that they're damaged, and it stimulates the healing and rehabilitation of those tissues. A lot of people ask whether Shockwave can help reduce pain in their body, whether it's back pain, knee pain, shoulder pain, etc. And so the concept behind Shockwave is not so much that it's designed to stop pain, similar to like a Tylenol. We're not trying to stop pain. The purpose of Shockwaves is to stimulate the regeneration and healing of tissues. Once tissues become healthy, your body doesn't need to give you a pain signal anymore. Pain is a result of injury in the body. And when the body can get through and heal the injury, there is no more pain. So the fun thing about Shockwave is the variety of injuries that we can treat with it. We've had patients in and amazing results, better than even I was expecting before we got the technology into jaw issues for people, shoulder issues. We use it all the time on the spine. One of the biggest benefits of it is for people that have herniated discs, just speeding up the recovery of herniations. We've used it on hip joints. We've used it on torn meniscus in the knee, plantar fasciitis in the foot. Probably one of the most common ones is plantar fasciitis in the foot, and all just get tremendous results with Shockwave. One of the great things about Shockwave is really how convenient it is and how short the session times are. Number one, typically we're putting in between 3,000 and 6,000 waves per session, and that usually takes between 5 and 10 minutes to get done. The treatments will vary, obviously, depending on the type of injury that's around, but we usually try and space the sessions out between, maybe every 4 and 7 days is the right amount of time in between sessions, so that the body can do some healing in between sessions. And then anywhere from 6 to 10 sessions is usually required for an injury, and that will vary depending on what type of injury it is. So a lot of our clients, a lot of people ask me, when do we use Shockwave versus other therapies, including chiropractic care? I would say number one, we always want to make sure, and this is a chiropractic approach, we always want to make sure that the nerve supply going to the damaged tissue is normal. So we want to make sure that your brain's able to control healing. I can put all the waves into a shoulder that's possible, but if there's nerve interference going to the shoulder, it's never going to heal correctly. And then we don't usually start with Shockwave Therapy. Shockwave Therapy is something that gets added in for a lot of people if they're maybe not responding to the typical treatments that we do. As far as other therapies go, to be honest, I've not found something that's more beneficial and has no downside compared to Shockwave. And so that's our first line of defense against people that have either acute or chronic injury. Outside of the chiropractic care that they're getting, the very first thing that we will get them on is Shockwave, and it's often the last thing we need to get them on because it just works and they heal. Shockwave Therapy is pretty new. The best way to find a chiropractor or another healthcare professional like a physical therapist that utilizes Shockwave is to do a Google search, look on their website. It's almost always listed as a service. In our office, we've been using it for about a year now, and we do have information on our website, discoverchiropracticmn.com. You can search that out and learn a little bit more about that there, but that's the best way to find it.